Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In today's video, let's explore how you can manage and heal your muscle aches and pains, also called myalgia, with natural and effective therapeutic tools. In the last video, I gave you quite a lot of information about occipital neuralgia, which also has to do with tensed or hardened neck muscles. Most commonly, your doctor will prescribe a muscle relaxer or their options of nerve block injections. Now, the name muscle relaxers in itself maybe gives you the impression may be helpful or even harmless, but think twice here. Muscle relaxers are actually both highly addictive and dangerous when they're not used as prescribed or intended. So enjoy this video, because I want to give you a really good, natural, effective treatment protocol without side effects. To stay updated with my ongoing videos, subscribe to this channel, share and like this information, and don't forget to click that bell as it notifies you every time I upload a new video. To learn more about Medica Nova and its work, go to our website, medicanova.net, at the Medica Nova Online Education Department, where you will find comprehensive study online courses in integrative medicine, homeopathy, health and wellness coaching, mental health, positive psychology, and so much more. To schedule your appointment for adults as well as children, contact us at health@medicanova.net. So what is a muscle ache or myalgia? Well, muscle pain can be localized right in one muscle or generalized too, and then we often talk about fibromyalgia. Now, the main muscles that ache are the deltoid muscles, sort of covering the upper shoulders here, muscles in the neck, muscles in the lower back, and I see a lot of patients with cramped calf muscles, especially during the night, or thigh muscles. Now, muscle spasm results from inflammation that occurs when a muscle is overstretched or torn. So you see there are two aspects here. We have the inflammatory aspect as well as the injury to the tissue, and a muscle relaxer will not address any of those. A muscle strain doesn't sound like a serious injury, but it actually can be quite painful. And I know patients who end up in the emergency room. Muscle strain or pulled muscles often occur also in the lower back. Now, the lower back problems are actually one of the most common reasons for the use of muscle relaxers. But however, most of the time, even acute lower back pain results maybe in 4 to 6 weeks without even any treatment. Muscle pain is also associated maybe with other symptoms like stiffness or weakness in general, especially if there's a flu involved, for example. Sometimes it can be accompanied with fever, and sometimes you can see skin rashes as well. Usually there is a swelling, and sort of the affected part is quite inflamed, maybe hot to touch even. So what is the problem with synthetically produced muscle relaxer medications? Well, the problem is that it doesn't address the problem. It's almost, a joke. So the problem with typical prescription or over-the-counter muscle relaxers, such as non-steroidal anti-inflammatory drugs, is that they don't address the core, the cause, the actual root of the problem. They shut off the communication between your nervous system and the brain so you don't feel the pain, but the actual situation is not resolved. And it comes with a whole truckload of side effects then. So we understand that the muscles aren't addressed, but suddenly the nervous system is just, paralyzed, so to say. But however, the shut-off isn't localized just to the painful or the spastic muscles you will have the problem with. It affects now the entire muscular system of your body. So suddenly you maybe have constipation because the peristalsis, or the muscles, the round and the longitudinal muscles in your colon, feel sluggish. They don't work so well. Or you feel brain fog, lack of concentration, because the vagus nerve is now affected, which is the bridge between your digestive system and your brain. Muscles relaxers should not be taken for longer than 3 weeks anyway. And the side effects also with muscle relaxing drugs are common. It can be drowsiness, dizziness, often you have a dry mouth. I see urinary retention. So what does that mean? It means an inability to completely empty your bladder because your muscle is now sluggish here as well. I see fatigue, I see weakness, but I also see the addictive aspect. Muscle relaxers can also aggravate or even cause acid reflux, like GERD, right here in your upper part of your esophagus. There are two main types of muscle relaxers. So we have the spasmolytics, which is antispasmodic, and the neuromuscular blockers. Usually the spasmolytics are the more common ones. Now in the US and as well as other countries, muscle relaxers are commonly abused. The problem is that muscle relaxers can act quite fast, right? So you have pain and, oh God, suddenly you have a relief. But you also can get easily addicted to them, and I tell you why. So when some muscle relaxers we have here, carisoprodol, for example, in the US are ingested, they also are converted by the liver, which is your detoxification organ of your body, into a chemical with anti-anxiety properties. Okay, that means that not just your muscles get pain-free, but suddenly you feel like, wow, I feel like quite cheerful and less worry and less anxiety. So it also has this addictive, would say, next expression to your mental and emotional balance, which is not so great. So why take a prescription drug to relax your muscles when there are so many other ways, natural ways to accomplish your goal in a more holistic manner and without side effects? For example, I would say homeopathic remedies prove very beneficial here, and I share with you quite a nice bunch of it in a minute. I would say natural homeopathic remedies for muscle pain not only relieve the pain, but also strike at the root of the problem, and that's what we want to look at, so there is a lasting cure. They are natural, and they also have no side effects. As just mentioned, the commonly prescribed muscle relaxer medication only provides, in this case, temporary relief, and the real cause of the muscle pain is not addressed. While I was sort of preparing for this video, I really got interested in where does this idea come from, muscle relaxant in the first place. And I found that actually the whole story started right back in the 16th century, when European explorers encountered natives of the Amazon basin in South America using poison-tipped arrows, right, that produced death by skeletal muscle paralysis. And what they used was curare, which is sort of a poisoned, they put it on the tip of the arrow, and that led to death, basically, when they were hunting for their meals. So this poison, or this idea or this exploration led to some of the earliest scientific studies in pharmacology. And in 1943, neuromuscular blocking drugs became actually established as muscle relaxants, official drugs in the practice, during surgery or as an anesthetic. And I think that's where it's appropriate. Right? It's beautiful, but it shouldn't be abused, for all sorts of things. So what are the causes? Most of the causes are, you experience a muscle pain because you overstretched the particular muscle, there was overstrain, maybe you exercised a lot, excessive physical exertion, you were lifting heavy weights, muscle tension in general. We often have here muscle or tension headaches, comes from sitting too long on the computer or something is bothering you. Talk about that as well. Muscle cramps in general are the main reasons behind muscle pain. There can be an injury, trauma to the muscle, including strains. But then there are also some sort of like medical conditions like fibromyalgia, chronic fatigue syndrome, comes also with sort of unexplained muscle pain because there's lack of sleep, we have the memory issue, the extreme fatigue, loss of concentration, and so on. I also see thyroid issues, underfunctioning as well as hyperfunctioning thyroid. You want to think about certain infections. So if you have a strong flu in the second stage, you often feel muscle aches, right, with heaviness and droopiness. You want to go to bed because your muscles are aching. Lyme disease and so on. Autoimmune diseases, I would include here, of course, as well. And they also talk about compartment syndrome. And it arises from pressure built up in a muscle compartment. And that results because, there's an obstructed flow of oxygen, blood, and nutrients to the muscles and the nerves, blood vessels, resulting in their damage. So in occipital neuralgia, for example, you have maybe the impinged greater or lesser occipital nerves. And why is that? Because here the blood vessels, where the impingement happens, are now blocked as well, and they can't sort of carry nutrients to the nerves, so they get damaged. That's why you have to try to open up more space in this area so we have blood flow. Electrolyte imbalance, if you have a deficiency in potassium and calcium, it can add to that as well. And I would say certain medications, we all know that statin, taken for a long time, can actually produce muscle cramps and muscle spasms. As a healthcare practitioner at Medica Nova, I'm always interested, of course, in the totality, in the wholeness of the patient. So I also want to know what caused, your muscle spasm and muscle pain. Is there something in your life which causes you to tense up? Let's look at your work situation, your marriage, your spousal, your relationship with everyone around you in general. How about your children, right? Maybe financial worries. Were you moving residence recently, which causes you to tense? And there are many, many reasons. So we want to explore that as well. And here I want to give you some food for thought. I like to refer to Jacques Morel's book, references here, and he says, the muscles are controlled by mental force. It is the life, the power, and the strength of our bones, right? So it goes very, very deep. It is the reflection of what we are, what we believe, and think of becoming in life. So if the muscles get tensed, right, we can't move forward in life. It stops us. The muscle represents the effort to be expended and the work that must be carried out in order to move ahead. The muscles, which correspond to my mental energy, are actually necessary for moving and taking action. They symbolize development and vitality. Ailments in my muscles, he says, shows me that I feel maybe powerless about a situation, even as though I were in a straitjacket. I feel diminished in my physical, intellectual, or emotional strengths. And this causes a diminishing of my performance or my capacities. All my experiences and my related feelings are also ingrained in my muscles, right? So when something is tensing you up, your muscles will tense up immediately. It's a direct link, it's a direct mirror expression. My inner states corresponds exactly to the state of my muscles. They react strongly to any overstress I experience. And I'm not talking here about just, heavy lifting, or you go to the gym and you have overdone it a little bit. No, this is about, who is pulling you, or what situation is pulling you too much in your life so your muscles tense up. As my body is made up of muscle, it will take on the form of my thoughts and the attitudes that I convey. Now, if I easily, then succumb to the negativity of my mind and the depression, the anxiety, and the fear, I will adopt an equivalent posture. Your muscles will tense up. Now, on the contrary, if I have joy in living and, connection with spirit, there's more positivity in my life. Your muscles will not only be firm, but also flexible, and that's what we want. I have to admit, I have to share something with you. I sit a lot on the computer because I'm an educator, a faculty at a university here. I teach students, so I sit a lot on the computer, and often I think, just another 10 minutes and I finish this assignment or something like that. And I feel, while I say that, at the same time that my body at that point says already, come on, have a break, walk around and then start again. And my mind often overtakes it, and then I do feel the muscular spasm, muscles tensing up. So it can be very easy, right? And then, of course, if this goes on for a longer period of time, you will have a symptom, and then you have to have treatments. So let's start with some effective holistic treatment protocols. We're going to focus on the external application here first, because muscles respond very well to, healing creams and salves and oils and essential oils and all of that. The first one I like to share with you, it's called arnica oil, and I put a picture up here. It's comes from a plant, comes in different forms, as I said, oil, creams, ointment, liniment, salves, and it's a very potent remedy for various inflammatory and exercise-related injury. It contains thymol, and that has been found to be very effective as a vasodilator, because that's what we want, of subcutaneous blood capillaries. So it doesn't contract, it actually expands, which helps facilitate, therefore, the transport of blood and other fluid accumulations, and acts as an anti-inflammatory to aid normal healing processes. We talked about this situation where suddenly the blood vessels are impinged, they can't bring nutrients to the nerves, and arnica will help you to open up the space again. The beauty here is that it stimulates the flow of white blood cells, which is part of your immune system, which process congested blood to help disperse trapped fluid from the muscles, the joints, and the bruised tissue. Right? So when you have a bruise in your body, it means that there's coagulated blood. Right? That's why you see the bruise. In Europe, you maybe see a product called Trapezius, which is also a wonderful cream. It's quite multi-targeted, multi-component. It's a natural medication to ease the inflammatory aspect, especially for the muscles. I also advise you to consult with a professional chiropractor, an osteopath, a practitioner of structural integration, because they help you to, not ease also the back pain or the neck pain, but alleviate anything which blocks in your body, and therefore, create a more pain-free alignment. They work on your structure of the body, and it's drug-free, and I can really recommend that. Find somebody who you gel. There's a chemistry, because every chiropractor is very different in its sort of approach to their structural alignments. Keep moving your muscles. You think like, no, I just want to keep still, and no, don't do that. It's a good idea to keep moving and keep the muscles loose to reduce disease-causing inflammation. But of course, be gentle. Don't go overboard here. Take a little time to rest in between. Have your ice or your heat cold packs in that, whatever you like, whatever works for you. I also like essential oils. Really work well here. I prefer frankincense as well as lavender because it calms down the nervous system. Citrus oil is also very well here. It's an excellent remedy for inflammation and nerve pain. They also suggest peppermint, which is wonderful, yet I would say be cautious here because it maybe counteracts the homeopathic remedies, which I share with you in a minute because it's very strong smelling, but it's a great remedy here as well. Massage, yeah, oh God, we have studies, many inform us that massage therapy definitely improved bone and muscle pain management, so let's go for that. Avoid pain triggering foods. And here we talk about sugar because it stimulates inflammation, increases the pain. Do I have to mention alcohol? Of course, caffeine, trans fats. That's a big one here as well because again, it increases inflammatory responses of the body and pain in general. Excess calories because that sugar, right, being overweight exacerbates, of course, back pain. I like also the addition of Epsom salt bath or also magnesium supplements, right? Deficiency in magnesium includes muscle pain, fibromyalgia, as well as leg cramps. Even just soaking your whole body or even just your feet in Epsom salt bath, so to say, or just a bowl of hot water, you can increase the internal magnesium levels, which are essential to your muscles working properly and avoiding the need for muscle relaxers. As I said, you can also take a good magnesium supplement. In general, healthy magnesium levels, for example, in this case from Epsom salt, use can help overall bodily inflammation since low magnesium has been linked to higher C-reactive protein, which is a marker of inflammation in your body. Let's talk about homeopathic remedies because I think this combo of external application and internal focused, really effective remedies is the way to go to really address this situation. I already mentioned homeopathic treatment focuses on treating the root cause of muscle pain, like overstraining, there was an injury, the inflammatory aspect, also the autoimmune process, right? Not just, okay, we want to relax the muscles. By treating the cause, these occurs gradual, there occurs then a gradual relief of the pain. You see less pain. And at one time, the pain resolves also completely. And I can say that because I tried it on myself, right? Not just talking from the books. So both acute as well as chronic cases of muscle pain respond well to homeopathic remedies. They can be given for all age groups, right? Are entirely safe to use. And they're of natural origin, no side effects. And although the suggested remedies are available online, over the counter, they're affordable, right? 3 times underlined too. It's good to check in with a homeopath. Contact Medica Nova at health@medicanova.net to schedule your appointment with us, and I'm happy to help. Usually when you buy over-the-counter remedies, there's a number behind the name, it's a Latin name, and here I would suggest 30C. The first remedy comes to mind, it's called Rus toxicodendron. Again, I put a picture up, it's a plant, it's a poisonous plant, but of course not in the homeopathic form. It's the first remedy to think about for muscle pain accompanied with stiffness. It's really a remedy which is on the top position when it comes to treating muscle pain in general. And this remedy can be used to relieve muscle pain anywhere in the body. The key indication to use it is the muscle pain gets worse at rest, but it's better on continued motion, right? So it's like the first, get up from a chair maybe and you feel like, God, oh, here it is again, but then continued movement makes it better till you get exhausted again and it starts all over. It's the best remedy indicated for muscle pain from overuse. So overlifting, overstretching the muscle, maybe muscle pain from doing excessive exercise could be really good here. Pain in leg muscles from excessive running could be part of that. Pain in the muscles of the arm from carrying heavy weights. Neck pain from prolonged working on computers. It absolutely healed my neck pain. Yes, I did suffer from, tight muscles, and Rustox is just fantastic here. Back pain from heavy weight lifting or sudden jerky movement, right? It's also, of course, a great remedy for arthritis and rheumatoid arthritis, fibromyalgia, for example. So it can be used for any muscle pain in the body. And also, remember the keynote of this remedy is when you feel like a stiffness happening here as well with the muscle pain, particularly in the neck, which aggravates towards the evening. So the keynote here, it's very beneficial for muscle pain and stiffness also in the lower back, which gets worse on sitting, maybe lying down, but moving relieves it. As I said, it's the leading remedy to help cases of lower back pain due to straining of muscles from heavy weight lifting. I think that's a big one. Deltoid muscle pain, I mentioned that. It will be great here as well. Often you also feel like there's a stitching pain in the shoulders, can be used for acute shoulder affinities and ailments, which get better for movement. So remember this keynote, right? In homeopathy, we have remedies with specific modalities. Modalities mean what makes it better and what makes it worse. And we differentiate each remedy from each other. So the keynote is Rustoxicodendron, or Rustox in short, is for overuse, overstretching, overstraining. And the characteristic keynote is muscle pain with stiffness. And I would say for adults, you want to take maybe one tablet 3 to 4 times a day, and stop taking any more tablets once improvement sets in. Of course, contact your homeopath. We have another remedy called Bryonia alba, also based on a plant, 30C, and it's actually exactly opposite in its modalities to Rustox. So Rustox, is indicated for muscle pain, which is worse on the first movement, but continued movement makes it better. Bryonia is worse for any slight movement. Any slight movement makes it worse. So you want to keep still. It's very effective for neck muscle pain and pain in the muscles of the lower back. As I said, movement or stooping are almost impossible, right? It's really painful. Bryonia is also a great remedy indicated when you have muscle pain from coughing, so your entire abdominal muscles are painful during a cough, because any slight movement makes it worse, right? And here in the abdomen we also have a lot of muscles. So the keynote to remember here is Bryonia can be given in any case of muscle pain that gets worse during movement, while relief sets in on lying down or keeping still. I would say again 1 tablet, maybe taking 2 to 3 times a day, and reduce it when the severity of the pain sort of calms down a bit. Now, we talked about injury and trauma, and here I would say Arnica montana, also a plant. Here I would say the potency 30C, but also maybe 200C when it's really intense. Fantastic remedy for sore muscles from an injury or overexertion. So here we talk about trauma. So it's not just overstrain or overexertion or torn muscle, but it's more of real injury. It treats sore and painful muscles from an injury or overexertion, but Muscle injury may occur from a traumatic fall, for example, or a blow against something hard, so you have bruising involved. And we just talked about the external application of arnica oil, right? Which could be both, could be fantastic combo. You bring in the external application as well as taking the internal remedy. Now the affected muscle is very tender to touch, along with the pain. It's also indicated for muscle pain in case of influenza, viral infection of the nose, throat, sometimes the lung. Let's say you have an injury first. Then I would say start with arnica. Arnica 200 for adults, maybe one tablet 3 times a day for a day. And then follow it up with Rustox 30. Right? That would be a really nice combo here as well, because it addresses the injury, the shock and the bruising of the tissue, as well as the mental emotional shock, and then heals, of course, the muscle or the tightness or the stiffness as well, which is accompanied with it. So sometimes you have to combine the remedies, but take them one after each other, not just all in one day. Remember to use arnica for muscle pain from overexertion, injury. It's actually an infallible remedy in such cases, brings relief in pain, soreness, along aiding the healing of injured muscles. As I said, take it in a 30, see if you have that as well. If a lower potency, if you don't get the higher potency, then I would say almost a little bit 4 to 6 times a day, maybe with a 3-hour gap for 2 to 3 days. With a 30C, you have to take it more often rather than with a 200C. And when the pain starts to recede, then bring it down to maybe only 2 times a day for another week. Another remedy which I like to mention here is called Ruta graveolens 30C, and that is for a strain or pulled muscle. Right? It's very specific. Again, comes from overstretching or tearing of the muscle. The muscle pull can occur from using a muscle the wrong way, maybe overuse of a muscle or an accident. Often people needing it feel sore, there's an aching, a bruise pain with the affected muscle. It definitely, brings pain relief along with the relaxation and healing of the overstretched muscle. If you have like a pulled muscle or a torn muscle, you maybe start with arnica, right, and then go into Ruta graveolens, a nice one. Ruta, again, 30C. The same here, maybe 3 to 4 times a day until improvement sets in. We also talked about muscle cramps, right, where we have the spasm now. It's not just a pulled muscle and a sore muscle, but the cramps. They come really out of the blue, and you have, for example, spasmodic cramping in your calf muscles in the night. We have a wonderful remedy called magnesium phosphoricum, or MagPhos, and here I like to use the lower potency, 6X maybe, or 6C. It's really nice. It's indicated for involuntary muscle contraction, so we have this tightness, and which causes then the pain. It works well for pain occurring from cramps in any, body muscle, especially the calves. Remember that? Muscles in the back of the lower leg, the feet. In case you need MagPhos, a person complains of cramps from prolonged exertion and also at night. It most frequently is recommended more in the lower potency, as I said, because it acts more as a tonic. I would take magnesium phosphoricum, maybe 6X or 6C, 3 to 4 times a day, according to the intensity of the pain. I give you another tip here as well. MagPhos is a great remedy for TMJ, trigeminal neuralgia, right, when the nerve is affected, but also a great remedy for sort of cramps before the menstruation, a week before you have your period and everything is cramping and painful, Magfos is a great remedy here as well, and then stop once your menstruation starts. I talked about that sometimes we experience muscle pain due to a flu, influenza, right, viral infection. And often it starts with, oh, I have a sore throat, or I'm under the weather and, I go down with something. The first remedy actually to think about this is aconite, Aconite napellus. 30, it's a great remedy just for the initial onset of a cold, and maybe you catch it. Well, if you don't catch it, right, and you don't take it on the first day, the second stage of an influenza situation is usually the aching muscles, the heaviness. And here we have a remedy called Gelsemium sempervirens. Beautiful. Muscle pain along with weakness and heaviness. So mostly it helps with muscle pain, in the limbs, the arms and the legs. The affected muscle area is sore to touch. Apart from you feeling weak and heavy, is highly valuable remedy to manage muscle pain that occurs during influenza along with the fatigue. It's also a great remedy if you have this muscle tension in the occiput here and you have occipital headaches. First remedy I would think about. Again, low potencies is better, 30C, taking maybe twice or 3 times a day. I wouldn't take it more longer than a week. Then you maybe need another remedy. Often after 3 days you feel already the muscle, the heaviness, the weakness is resolved. So I hope that this video has inspired you to seek out more holistic treatments rather than taking the commonly prescribed muscle relaxers, which come with a truckload of side effects. Now, again, if you want to learn more about the principles and the concepts of homeopathy and how to apply it, with your loved ones, your friends, your family, why not register for our 16-week study course? It's called Thriving with Homeopathy, a practical guide for the whole family and beyond. Now, although it's an online course, I will guide you step by step through this comprehensive study material, and after completion, you will get a certificate of completion. So refer to the course link below. I put that in the description box too. And till next time, take care.